Each week I receive about 12 or so proposals from various skincare companies and brands that wish to partner with me and have me endorse their product publicly on my channel. So the translation of that is that they would like to send me free product for me to, in exchange, give my positive opinions and thoughts about on my channel to my audience, you. And each week I politely decline all of these offers, and I have not accepted one yet, as you can see on my channel. None of my skincare related videos have ever been sponsored. And that is because my opinion cannot be bought, my thoughts cannot be bought, and no amount of money will be enough for me to falsely endorse a product that I myself don't use and love and have tried and tested and used myself. It's simply not going to happen. I don't lie in my life, and I'm not going to start lying on my YouTube channel. Any company with whom I work, be it a skincare company or otherwise, now or in the future, it will be a product that I genuinely use and love and endorse authentically, that you can count on that from me. And I say this not to be self-righteous or to come across as morally superior. I say this because I am a consumer and a customer, just as you are watching this. So yes, I happen to be on a public-facing platform because I've elected to put myself here, but I'm a customer at the end of the day, just like you are. So I'm not a QVC channel, and I'm not aiming to become one. That was never my intention for starting this YouTube channel. Now I have found myself in a position of being a so-called influencer, for lack of a better term, and having a presence on social media, although this is the only social media platform that I exist on. But even my small presence, my minimal presence here has afforded me all these opportunities. But rest assured, I'm not going to be shilling product for any amount of money. That's just not my style. I'm the one at the end of the day who is going to lay my head on the pillow, and I like to sleep soundly at night. So I will say that I certainly am fortunate and I'm grateful, and I don't take advantage that I am in a position of luxury, being able to choose, being able to reject these offers, as it were. So I will acknowledge that I think it's a position of privilege to, number one, even be offered these opportunities, and number two, and more importantly, to be able to refuse these opportunities. So I would like to just acknowledge those two things, but in the same breath, I want to say that it's my right to exercise my right to choose. And I'm picky. I'm very picky and I'm very particular. So I don't use any old thing. And I'm not saying this because the products I use that I've used for decades, in some cases, they are products I've used since the literal age of 12, and I'm 41 years old now. So I'm not saying this because these products will be universally successful for each one of you watching. I say this because you can trust my word that they are products that I have used for that length of time and that I have tested and tried and have used with great success and consistency in my own life. And I feel the way I feel about them, period. I'm not being paid to endorse them. And if in the future I am paid to endorse the products that I already use, I will cross that bridge when I get there. But in the meantime, I'm happy, more than happy, to endorse them without compensation of any kind. Those products that I use and that I recommend, those are my secrets. So it's all out there. I have nothing to hide anymore. I have nothing to share anymore. It's very boring at this point because it's repetitious. But maybe there's value in knowing the consistency and the brand loyalty that I have. So now I want to talk about Tretinoin, one of yours and my favorite topics, anti-aging skincare, and my experience, my personal experience, and my gold standard product is Tretinoin. This is my so-called hero product in my skincare regimen, and it's the one that I focus on. But I would also like to talk about Adapalene, brand name Differin, and I would like to talk about these two chemicals and just kind of break down what they are, because I think it's valuable to learn if you are new to skincare, certainly new to anti-aging skincare. It's good to know what these products do, what each of them promise, and why you might want to use either or both. So Tretinoin, brand names include retin-A, Adapalene, Renova, Refisa, and others. Tretinoin is a prescription topical retinoid used for anti-aging, primarily skincare treatment. It also reduces oil production and it increases the cell turnover. So our skin naturally sheds. This is a natural cycle of the skin cells, but Tretinoin accelerates this process, puts it into hyper mode, if you will, so that it happens much more rapidly and we get that new, fresh, glowing skin that's underneath the surface, quite literally. So that's the mechanism by which Tretinoin works. And it's that constant sloughing off of the dead skin cells and the dull skin cells that, especially as we age, the measurable difference is much more visible. So this is why I get so enthusiastic when talking about Tretinoin, not only because I have the lived experience of having used it for almost 22 years at this point, but also because I believe in this product wholeheartedly. If you are going the topical route of skincare like I have chosen to do, this is a very good option, all things considered. Another thing that Tretinoin does, and does very well, is it leads to the growth of new blood vessels. So it synthesizes new blood vessels, making it one of the most potent and effective skincare topicals available on the market. Tretinoin also prevents acne. So many of you have asked if I have ever had acne, and yes, the answer is yes. That was a nightmarish phase in my life. As a preteen and teenager, I had horrendous acne, in fact. So yes, I had very typical acne-ridden skin that you see in teenagers and preteens going through puberty and adolescence. And I did go through that period. And when I started my topical treatment at around the age of 20 with topical retinoids, that got worse before it got better. In fact, it got much worse before it got better. So there's that purging phase you hear of. I definitely went through that. And it was just, looking back, it was a nightmare, frankly. But I am, as you can see, beyond that, well beyond that. So that's what I always say, is that if you can get through that hellish phase of orientation with this chemical and then purging phase to eventual maintenance phase after initial treatment, the reward is that makeup optional skin that I think we all want. You know, I think it's a universal desire that we all want to put our best face forward, literally. And this is definitely, as I said before, a viable treatment option. So Tretinoin works by acting as a superficial chemical exfoliant. It's a chemical peel, effectively. That's what it is. It's a chemical peel. So another benefit is pore regulation and the treatment specifically of visibly enlarged pores. So as we age, the pores become more visible. That can be caused by a number of factors, but one of the main factors is excessive oil production will cause a visible increase in the pore size. And Tretinoin inhibits oil production. So in this way, Tretinoin smooths the pores and makes them visibly smaller. And I can attest to this, that my skin now at age 41, it looks better than my skin when I was 25 years old. So it's quite remarkable that, I have said this also before, but it's quite remarkable how the effects of Tretinoin, and this is evidence-based, by the way, it's not anecdotal, the effects are cumulative and compounding the longer you use this product. So that's very exciting, because if you use it for 10 years and then 20 years and 30 years and so on, it gets better and better and better as your skin keeps adapting and keeps maintaining that chemical peel effect. It increases collagen production. It lends to an overall smoothness of the tone and texture It decreases the dullness, which is to say it increases the skin's radiance. I would also like to differentiate between tretinoin and retinol. There are many products in the drugstore, you will perhaps have noticed, containing retinol. And retinol is great. It's sort of like a baby step to tretinoin or retinoids, but tretinoin is much stronger than retinol, so it's more concentrated. However, this potency of tretinoin, you probably can guess, comes along with a downside, a major downside, which is with that potent concentration and efficacy comes harsher and more pronounced side effects. So if you have hypersensitive or ultra-reactive skin, tretinoin may not be suitable. You may not be a suitable candidate for treatment with tretinoin. And by the way, because tretinoin is only available by prescription, by a doctor's prescription, your prescribing physician will guide you along the course of a proper treatment. And if you are not a good candidate, if your skin type and your lifestyle does not suit you to be a suitable candidate for tretinoin, he or she will eliminate that as a possible treatment modality, and they will offer alternatives such as Differin. So those with sensitive skin or hyperreactive skin will obviously experience greater discomfort even than those who are suitable candidates. So you can imagine that the harshness of the side effects will be prohibitive for a certain number of you watching. And it's nothing wrong with you or your skin. It's just the way it is. Everyone's different. Everyone's body is different. So again, your prescribing physician will guide you along the best course of treatment that will suit and serve you the best. So that is up to you and your healthcare provider to have a consultation and a discussion about that. And any responsible physician will have that discussion with you from the get-go. They will not just willy-nilly prescribe you something potent and potentially harmful to your skin. So now let's look at Differin. And Differin is the brand name for Adapalene gel. Differin is one brand of Adapalene, I should say, which is a topical retinoid that is available over the counter. And so this is without the need for a doctor's visit or a prescription. And it should be noted that Adapalene has been prescribed for over 20 years, and now it is sold without a prescription. So very exciting that this tretinoin-like compound, you can achieve same or similar results with this compound as you would with tretinoin. This is available over the counter and at a very affordable price. So I get very excited talking about this as well. And I use both because I do have a sweet spot for Differin because I used it way back in the day when it was prescription only. It's a good starter retinoid. It can be looked at as like a tretinoin light. And I use both to this day, both tretinoin and Differin, because frankly, I just have a nostalgic sweet spot for Differin. I like the product, I enjoy the product, and I like recommending it to friends, family, you. So therefore, I continue using it so that I can maintain my experience with it because I enjoy the product so much. I've given it as gifts to family members, and they have enjoyed it, and they have used it and incorporated it into their own skincare routines with great success. And it's just a beautiful product, and it's so inexpensive, and you can pick it up at any drugstore. I've seen it sold at grocery stores even. So that's why I'm so gung-ho about Differin. And the primary use of Adapalene is acne treatment, actually. Acne treatment and control of acne, which is to say prevention in the long run. So it keeps acne at bay with continued use, so it can be a good long-term solution to prevent breakouts. So it will have that clearing and controlling acne effect, but it also comes with added benefits to the skin overall, including enhanced overall texture and tone, so smoothness, radiance. It will decrease the dullness and increase the glowiness of your skin with consistent use. And in the same way that tretinoin works, it will adjust your skin cell turnover so as to accelerate that process and have the dead skin cells be replaced by those fresh, new skin cells that lie underneath. In clinical studies, in fact, Adapalene has been shown to be superior tolerability to Tretinoin. Because the effects are essentially the same, although Adapalene requires longer treatment and it's more gradual, which is to say you need to exercise more patience. The side effects of Adapalene are very minimal compared to Tretinoin. So that's what they mean by demonstrating superior tolerability. This product I have seen being tolerated in teenagers. It's a very good product for teenagers, in fact. Get them started on Differin in their nighttime skincare routine, and you will notice a very good positive difference in their skin. It's also good to start that skincare routine. On a side note, it's good to start that skincare routine early and have that be incorporated much like brushing your teeth. So it's a very good habit to have to keep the skin healthy. And we want to start those habits young. I started my skincare routine when I was around 11 or 12, and I have never stopped since, because we want to take care of the whole body inside and out so that we can preserve what we have for as long as possible. And those good, healthy habits start young. If you notice, the benefits of Tretinoin are mirrored by the benefits of Adapalene. So you don't have to use both. You certainly don't have to use both. You can use one or the other. You obviously don't have to use either one. All of this is optional, and I'm never going to tell you to do exactly what I do or to copy my routine. I share my routine because it has been very successful for me, and it feels selfish to keep that to myself. I want to share my skincare secrets because I think it might benefit someone if they want to start a skincare regimen of their own. Maybe they can pick bits and pieces from mine and someone else's routine, but they can formulate a routine that will suit and serve them. And that's my hope, is that you can gather the knowledge and then make your own informed, critical thinking decision about this. So in conclusion, topical retinoids play a critical role in the controlling and prevention of acne, as well as in anti-aging topical skincare treatment. Retinoids such as Adapalene and prescription strength Tretinoin help by keeping the pores clean from being clogged. They decrease oil production, and they lend to overall enhanced skin tone and texture, as well as increased collagen production. It also increases elasticity in the skin. And while Tretinoin is harsher in its side effects, it is more powerful, more potent, more concentrated than Adapalene. But it won't be suitable for sensitive or hyperreactive skin types. Your healthcare provider or prescribing physician should inform you so that you can make a comprehensive decision on which course of treatment will best suit you, if either of these products will be suitable for your particular goals, your preferences, your lifestyle, and your ability to comply with the treatment. All of what I've discussed is precisely why I deem Differin and Tretinoin as superhero skincare products. So if you can only incorporate one ingredient in your skincare routine currently, I would say it would be a topical retinoid. So either start with the over-the-counter light version, which I would recommend Differin, Adapalene, or see a physician and have yourself assessed for possible prescription strength treatment with topical Tretinoin. So it's going to be stronger and harsher, and the side effects will be greater, but the outcome will match that. But I do want to emphasize, I do want to reiterate that you can absolutely get similar or same results using over-the-counter topical retinoids such as Differin, specifically Differin, as you can with Tretinoin prescription. So just let that sink in and really understand that. I know I've said it before, but it's worth repeating. It bears repeating, because I think people think that they have to go all in on skincare, and you don't certainly have to do that. You can ease yourself in, and in fact, it will be probably better in the long run to do that, because the process will be much more gradual, but in the same way, the side effects will be less harsh. So you will experience far less discomfort in the interim while you're treating your skin. So until you get to that maintenance phase where you can just coast, the treatment period will be much more tolerable as you see your skin start to improve. But the last thing I want to emphasize that these two things have in common, can you guess? Longtime viewers of me will probably be able to guess. The one thing these both have in common is that they both require patience and consistency. So you must be patient. You cannot apply either of these on your face at night and then in 2 weeks expect to see a turnaround difference. It doesn't work like that. So run far from anyone who's going to promise that you will see results in 2 to 4 weeks. And no, just get that out of your mind. Change your mindset completely. Expect to introduce this chemical, whether you're using Differin or Tretinoin, any topical retinoid. Expect to have an introductory orientation period of at least 6 weeks. So just set it 6 weeks. But in my mind, it's probably more like 6 to 12 weeks, realistically. In practice, that's what you can expect. So that's your kind of introduction period, orientation phase. And beyond that, you will start to see improvement. You will begin to see improvement. But the period of 6 to 12 weeks is just getting your skin acclimated to this chemical. Your skin has to adjust before the benefits can even be manifested. So in my opinion, if someone were to ask me, and this is only my opinion, I think you should set 6 months to 12 months. And if I'm being prudent, I would say give it 1 year. So whether you're treating your skin with Tretinoin or Adapalene, any topical retinoid, prescription strength or otherwise, give yourself 1 year. That's 1 year of your life. In the grand scheme of things, it's a relatively short period of time. And that year is going to pass anyway, regardless. So start applying retinoid, start incorporating a retinoid, a topical retinoid into your skincare regimen, your nightly regimen. Give it 1 full year. Just commit to that 1 full year and do it habitually. Because if you commit to that and you protect your skin, also protection is a big part of preservation. But protecting your skin, preserving it, and finding the plan, the skincare routine that works for you, and then sticking with that habit, that's the key. Consistency is king. So I wish you all the best of luck. If you have any specific questions, you may leave your questions down below, and I shall do my best to reply to them. Although, as I said before, I'm not an expert. I'm not a skincare expert. So I just want to make that very clear. I'm simply sharing what I do and what I practice and the products I use and would personally recommend in hopes that it is of some use to you watching this. So I wish you the best of luck. And as always, I thank you so much for watching and thank you for being here.